We're meeting up with our team made up of radiologists, advanced imaging specialists, sometimes biomedical engineers, surgeons, cardiologists, to kind of dive in. And if we're going to be working on a project, sometimes there's meetings on how we're going to achieve those things. So what does a typical 3D visualization lab look like? Well, we're going to have 3D printers, of course. We're going to have some wash stations. We're going to have a UV cure, usually, if we need to make some resins hard. Computer stations with multiple monitors, because a lot of times when you're segmenting on one monitor in your software, you might be referencing back to that image stack that's in your radiology PAC system that you're pulling up and looking at in the hospital and things like that. So you can kind of bounce back and forth and reference several things to make sure you're accurate. There's the heart up there in the right-hand corner with the sternum. The sternum actually can be removed, and then the apex of the heart is designed to come off with magnets so they can actually see the internal structures of the ventricles and the atria. There's a liver in the middle that comes apart, and actually we did a liver where it can actually come apart in all the segments of the liver. You can make anything possible really with depending what printer you have. You can encase things in clears. You can do things color coded. And then also we have the digital anatomy printer, which is the J850, and it can print in different matrices depending what you're wanting, whether that's bone or tissue. And then you can actually take those models and you can simulate surgery on them because they feel realistic to what you're actually going to see in the OR. I've actually had surgeons completely change their course of action of what they're planning to do in the OR based on our 3D models that they've simulated on prior to going to the OR.
This has been a presentation of the AMP Honors Program from CV Academics.